As Herman Melville said, we cannot live for ourselves alone. Our lives are connected by 1,000 invisible threads. Along these sympathetic fibers, our actions run as causes and return to us as results. These are the stories of invisible threads, magical to me, weaving through the Bronx as we speak, forged by Bronx needs, strengthened by Bronx innovation, championed by Bronx heroes, advancing a community's health. These are the stories of the Montefiore Einstein Center for Transplantation.
In Alexia's case, the real issue was that her heart was failing. She would have more and more difficult time walking, getting somewhere. Dr. Sue came to us and said that she felt now was the time. You've known about it in a way since her birth, but it's very hard to actually face it. And so at that point, you just kind of regroup and just try to figure out what to do next. When you first look at transplant, you always think about the surgeon. And then the more you learn about it, you start thinking about really the other players around it. The medical people really do it. And that's really, in the end, you say you need to have both. They both need to be superb, and that's kind of how we felt very comfortable at Montefiore. You need to make a very tough decision because you're really going to a place and saying, here's my daughter, and make her better.
I discovered I had hepatitis C, and I was being monitored. My hepatitis C was being monitored 2 years ago. They found a tumor on my liver, but they told me liver tumors reoccur, and they don't like cutting them out of sick livers. They usually recommend transplant. 7 o'clock in the morning on August 28th, they gave me my first transplant. I kept having sporadic incidences of rejection. I'd come back into the hospital a day or two to adjust the medication. They'd get it under control, and I'd go home. They changed my diagnosis from acute rejection to chronic rejection, and they relisted me. So I was continued waiting for organ from Montefiore.
I think the field of transplantation, when it started in the 70s, was really a field that was based in science fiction.
You take this piece of lifeless tissue from basically it's a cooler, and implant it into the patient, and suddenly pinks up and starts to make urine. That's just, outstanding.
Many times patients will ask, how long will it be before I'm transplanted? Do you think I'll be transplanted before the end of the year? Do you think I'll see my daughter getting married?
What kind of resources are available to help this person through their rough time? And the reactions to the illness, how are they coping?
Every time I saw him, I just wanted to kind of instill as much confidence that I could, that we were going to do the best we could do for him, that we were looking for the right liver and kidney for him to try to get him the best outcome.
I knew I was very sick, but I always thought I was going to get pulled through until the very end. We have two daughters that live in Florida, and they both had just bought houses last year. And they said they couldn't afford to come up and see me. And then
I surprised him. His two daughters, they just walked into the room. And even though it was a joy for him to see them, it wasn't a joy for them to see him because they did not realize he deteriorated that much.
My cell phone rang, and it was Jacqueline Moore from the transplant team. And she said, it looks like we have a heart for Alexia. So at that point, we grabbed the bags that we had packed a year earlier and drove down to Monte.
That sets a whole team in motion when that happens.
Our intensivists, our critical care specialists on the floor, our nurse coordinators, our bedside nurses, and nurse practitioners.
psychiatry, social work, transplant coordinators, a financial coordinator.
There's all the little pieces to put together.
The surgical team is deciding how they're going to get the heart, who's going to fly, where are they going to land, how are they going to coordinate getting the heart back to the Children's Hospital for the patient.
There's always a moment in a transplant when you've taken the old heart out and you have passed the point of no return.
You connect the patient to the heart-lung machine, and then you remove their heart, and they're in suspended animation for 30, 45 minutes or up to an hour until the donor heart is prepared and sewn into the chest.
I was shocked. I woke up. And my wife was there, my daughter, my son, and my first wife, who hadn't spoken to me in 23 years. In 23 years, she hadn't spoken to me. And I woke up, she was holding my hand.
Each day, something new great happened. So the pacemaker comes off, the blood pressure medicines come off, the chest tubes come out. You know, the first time she gives me that smile that you recognize that that's the way she smiles. And then the first time she said, I want to go home, so.
We make a lifelong commitment to those children and their families to say we are going to be with you every step of the way as we watch this heart grow, as we watch you grow.
I'd be extremely proud if all we did was excellent transplants on the patients that need it. But we really rise to another level, and we're able to rise to that next level because of the connection to Einstein Medical School. Because there you have some of the finest scientists in the country working on new techniques and developing new knowledge and educating the doctors of tomorrow.
I just knew they treated me really well, like I was special. And after I had my transplant and I've been around here a while and I come back and I see they treat everybody like that, I'm not special.